detection of the 2105-2117 DEL13 INS AGAAA mutation in the CFTR gene through PCR. For a little bit of background of cystic fibrosis, we decided to read multiple different research papers, one about Southern California Hispanic patients, written by Li Zhang Wang, another about treatment and diagnosis of cystic fibrosis by Suzanne Nehring, and another about the CFTR gene and its function, written by Victoria McCarthy. We found that common symptoms of this disease are lung and pancreas issues. Specifically, the lungs are lined with an excess and sticky mucus, and pancreas deficiencies in terms of function. We also realized that among ethnicity, that the carrier risks definitely differ depending on the ethnicity that you are from. Unfortunately, this disease is genetic, so that individual will have this disease for their whole life, where the average lifespan is 46 years old. Meanwhile, there are drugs such as DNase and antibiotics that help break up mucus. There are also treatments and therapy sessions that will allow individuals to detect and treat cystic fibrosis. I find it very interesting that there is over 1,000 CFTR mutations out there, and there continues to be more as science advances, which I think is very cool. The CFTR gene is 1,480 amino acids long, which accounts for 4,440 bases. And if you look here on our right, we have a normal channel and a mutant channel. And as you can see in the mutant channel, the chloride channels are closed and dysfunctional, so they're not working. So therefore, water and chloride are both not being not flowing. Therefore, you have a buildup of mucus at the top or outside the cell. And to dive deeper in our mutation, how I found is very interesting about this mutation is it's a novel mutation. It was actually discovered in 2001 in that Hispanic study that Wong did with Hispanic patients, which this mutation is found on the 7th chromosome on exon 13, as you can see in kind of the name. However, when you first look at this, you think it's very confusing, and you look at it and you question like what does this mean? However, after you do some research into it, you realize that this name is not as complicated as it seems. The beginning of it with the 2105, 2117 are actually just base pairs, and the DEL after is telling the individual that these are the base pairs that we're deleting. And as you can see in the figure to the left here, we have the exact base pairs that we're deleting that are the 2,105 base pairs all the way to the 2,117th base pair. And then as you can see, as we continue through the name, we reach INS-AA-AGA-AAA. And so this insertion is actually amino acids, and these amino acids are being inserted in the same place that those base pairs were. And when that does occur, then this DNA sequence then becomes a mutation, and therefore causes the cystic fibrosis disease to happen in humans. And as you can see on the right here, I drew a little diagram of what it would look like on the chromosome and in relation to the exon, and then in relation to what's actually happening in the deletion and insertion area.
Using Google Scholar and PubMed, we found 3 reviews and essays on the 2105 to 2117 DEL13 INS AGAA mutation. Each paper provides detailed instructions on the PCR-based diagnostic assay that was used to detect the mutation. Paper 1 is titled A Novel Mutation Detected by the Temporal Temperature Gradient Gel Electrophoresis Method that led to detect a prenatal diagnosis in a Hispanic CF family. This paper identifies the correct primary sequence and also the in-depth methods used to detect the mutation. In the figure, exon 13 is where this mutation occurs. Parent 1-2 is a carrier of the mutation, but does not present with cystic fibrosis. Offspring 1, 3, and 5 do present with cystic fibrosis, and offspring 5 was the prenatal diagnosis of the family. The prenatal diagnosis unfortunately led to a termination of the pregnancy. Paper 2 is titled An Improved Detection of CTRF Mutations in Southern California Hispanic CF patients. This paper is actually an expansion of the first paper, and it demonstrates the same amplification technique as paper 1. This paper discusses the pros and cons of the temporal temperature gradient gel electrophoresis method and the previously used in Nature gradient gel electrophoresis. ETGE was used in both studies because of its cost effectiveness and simplicity.
To further connect our biological research with other fields of study, we plan to generate a survey that tests a student's historical, philosophical, and sociological understanding of genetic diseases and evolution. We already know that cystic fibrosis is a progressive genetic disease that affects lung function. When the CFTR gene is not working properly, chloride is unable to move to and attract water to the surface of cells. This causes mucus in the lungs and other organs to become very viscous and thick. Aside from this causing inflammation and infection in lungs, it also causes wheezing, shortness of breath, coughing with extreme phlegm, as well as postnasal drip in patients that experience cystic fibrosis. Although there are many medications and medical grade devices out there that are able to help treat the symptoms, many therapists suggest techniques that are able to be done during breaks at work or at school. These techniques can include special breathing exercises to help break up the mucus in the lungs, force it out, high physical exercises that make you lose your breath very quickly, such as running and swimming, as well as chest physical therapies. And one of the most effective one is manual chest percussion, or MCP, which is when you have somebody else cup their hands and like tap and vibrate your chest to dislodge and break up the mucus at a 360-degree angle, which is why it's really important that you don't do it yourself, you have someone else do it, because they're also able to gain access to all 5 lobes of the lungs. Another recommendation that I was given to CF patients is to eat diets that are high in calories, protein, and sodium due to the loss of nutrients in their digestive system. So foods such as nuts, seeds, cheese, fatty meats, and avocado should be high in their list of what they should be eating, as well as supplementary vitamins, A, D, E, and K. And as a result of us doing this for 30 days and making these dietary changes and using these daily airway clearance techniques, we are able to gain a greater focus on how patients have to combat cystic fibrosis on a day-to-day basis.
So we've designed our own primers. This forward primer will attach here at this top red box, and the reverse primer will attach at this red box down here. And I've circled the region our mutation would be at in blue. So our reverse primer will only attach to the DNA and correctly perform PCR if the mutation occurs, where this highlighted section is deleted and replaced with AGAA. The annealing temperature for these 2 primers would be 64 degrees Celsius, and I've ensured that the separate annealing temperatures for the forward and reverse primer that I've designed is less than 5 degrees Celsius. As a backup, we can always use the primers that were designed by Lee-Jun-Si Wong for the paper we have listed first in our references, and the annealing temperature for these would be 55 degrees Celsius. For our positive control, we've designed a primer that will only attach to the DNA if the DNA is non-mutated. And you can see the bottom primer corresponding to the reverse primer at this bottom red section. And our forward primer is up at the top in the red section. And the annealing temperature for these 2 would be 62 degrees Celsius. Once again, I've ensured that the annealing temperature for both individual primers is no more than 5 degrees Celsius.
And then these are our references. Thank you.